ever gone without dental care, you know how awful it is. And it's something that medical experts say Spokane desperately needs more of. Well, now, thanks to 2 new grants, we're going to get 2 new dental clinics. The grants plus $2 million from the most recent state budget will help open those sites. You'll be able to run by Providence Healthcare and CHAS, the Community Health Association of Spokane. They will run those locations, and they'll help thousands of people every year. Our Hawk Hammer working for you tonight. And Hawk, this is good news because we know that emergency room is no place to treat dental problems.
Nadine, the progression here, if you go without dental care because you can't afford it, you end up potentially with tooth infections, and you come here to the hospital, to the emergency room, costs add up, you end up in a financial hole, still without a fix to that original problem. Dental care, and it's important to note here, emergency rooms aren't dentists. Chew on these numbers for just a minute. Right now, the CDC says 90% of Americans have tooth trouble, but only 23% of folks on Medicaid see a dentist regularly. That difference really bites. Why the disparity?
We have lots of dentists in the community. Unfortunately, a lot of the people that we see can't pay for that dental care.
Because many of the dentists don't accept Medicare or Medicaid, and the ones that do, they're overbooked.
There's just no access right now, you know, there's not enough providers, there's not enough places for these individuals to go.
As a result, care gets put on pause. No regular cleanings, no regular checkups, which leads nowhere good.
But the mouth has a lot of bacteria that live in it normally, and unfortunately, if there's not good long-term dental care, that bacteria can migrate into places where it's not supposed to be.
Dr. Dan Getz runs the ER at Sacred Heart. He sees thousands of folks each year coming in with painful symptoms that stem from not getting regular dental care.
You know, a lot of the things that we tend to see in the emergency department are just progressive symptoms related to tooth infections. So a cavity that gets carried away can start to cause a pocket of infection, an abscess, either in the mandible, the jawbone, or the tooth itself.
And unfortunately, when people do come in, there's not much the ER can do. They aren't dentists. They don't do that kind of surgical care.
Often we're performing patchwork care, so it's a short-term solution.
But that's about to change. The hospitals plan to build 2 new dental clinics, staffed by dentists and dental students during the last of their training, should be a huge help to people with limited dental coverage from getting stuck with bills they can't pay. And bottom line for the hospital,
everybody should have access. You know, you shouldn't be discriminated against for lack of availability to pay or, you know, availability to get your medical treatment and surgeries for.
And so here's the plan right now. Those 2 new dental clinics will open up. 26 new dental chairs, hopefully offering service to up to 12,000 folks each year. It's still in the early stages, just getting funded, so no word when construction will get underway or when those will open up. We'll keep you updated. Reporting live, I'm Hawk Hammer, KXLY4 News.
Thank you, Hawk.